Are you ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Amua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Megan Alonso.
Hey, como mai, and aloha. You're listening to Inspired by Amua, where we help you master the waves of medical product development. Each week, we interview guests that educate, guide, and inspire to give you the skills you and your product need to hang 10. If this is your first time listening, Amua is spelled I-M-U-A, and it's a Hawaiian word that means to advance forward with passion despite rough waves. There are plenty of those in the medical device industry, so keep listening because we've got you covered. So the guest I have on today is my first type of this guest. So he is an entrepreneur. He's started his own company. He's developed his own product, and he's just going to share some insight and wisdom all about that journey. So if you're listening today on your phone and you want to refer back to the website, you can get that at imua-services.com/016, because this is episode 16. So I'm ready to introduce my guest, John Alderete. John, are you ready to hang 10?
Aloha, Megan. Yes, I'm absolutely ready.
All right. So I gave that little introduction, but give us some more background into your personal, professional life and what's been keeping you busy these past few years.
Thank you. I am a microbiologist by training, but if you were to ask me on the street who I would say I was a dad first, a violinist second, and then a scientist and product developer third. I do have a pretty extensive training in microbiology. I was up at the Fred Hutch Cancer Research Center in Seattle and University of Washington. And so from that, have a good exposure to oncology as well. But professionally, I focused more on the business end and went off to get my MBA in Texas. This isn't the first time I've started a company like this, and I'm happy to share experiences from both this new one and the old one as well.
All right. Well, first of all, I want to know I didn't know that you played the violin. So tell me a little bit about that. Are you in a musical group that you play with, or do you play with just a local symphony group, or just on your own?
Yes, thank you. I've been playing most of my life, probably since I was about 7, if I can remember. It's been a long time. It definitely is a part of who I am, and it keeps me relaxed and focused. It's the one continuity in my life, despite all the changes of being an entrepreneur. I have been playing with a quartet for the past 10 years, but before that I was pretty serious and have toured with groups, played solos, and have founded my own groups, some of which exist today. In Seattle, there's the Lake Union Civic Orchestra. That is one of the largest community orchestras. It's just celebrated its 15th year anniversary,
Wow.
So it's definitely a part of who I am, and I'm happy now to pass the mantle to my son, who also plays, and help him out as he develops his own skills on his violin.
Awesome. So what's the most favorite place that you ever got to play?
I'd have to probably say my most favorite place that I ever got to play was in Austria, in either Vienna or Salzburg, to be able to play in the grand opera houses where that Mozart and Beethoven and others played and conducted is a pretty special thing. So I'm very grateful for those experiences, and I will always keep them in mind as I go forward.
Mm-hmm. And you bring up a good point, just that remains a constant in your life. So between the ups and downs of product development and running your own company and being a dad, all the challenges in life, that's kind of your escape. And that's an important thing to have, just something that's enjoyable that you should always do. So that's an unexpected piece of wisdom for us all.
I would agree. We all, in whatever place we are as an entrepreneur or not, have to find something that grounds us. For some people, it's cycling, which I also do, but some people it's long-distance marathons. For me, it's my music, and it is the one thing that I think keeps me, as you mentioned, grounded. Is very important to me.
Mm-hmm. So you mentioned your current company is not your first rodeo in product development. So tell us about what you were doing previously.
Well, I think in order to understand why I do what I do, I have to mention its absolute genesis, and that was following graduate school and not wanting to be a bench scientist or an academic scientist. There were fairly limited options at that time. So I came to the Bay Area in California and was a product level consultant for a group in the Bay Area and consulted for many multinationals. And I think for me, one of the inspiring elements was going to companies I won't mention, but we all know very large multinationals, and realizing just how bad the infrastructure was in terms of having groups communicate with each other. We were brought in to help with products that the answer was literally in the office next door, but because they were in different departments, they
Yeah,
literally would not
they're
talk
just
to each other.
siloed.
Yes, they were very
Yeah.
silent. And sort of naively, I think, but in a good way, I thought to myself, well, I can do this better. If it really is just about information flow and access, then there should be a way to do this in a different capacity that is much more productive. And to that end, I started a company. It was also a diagnostic company for infectious diseases. And the model, I think, was unique at that time because we raised maybe 1.3 million and took the product from concept to FDA approval in about 18 months.
Wow, you were rocking and
I don't
rolling.
think we could do that again. The um, landscape has changed a lot regulatory-wise,
Hmm.
but it really did serve a purpose to inspire me to understand that there are different ways of doing things than the usual model that we see.
Hmm. So what are those regulatory changes in landscape that you feel are different? And what would you say now is a more realistic timeline? If someone was just starting now, developing a rapid diagnostic test, what are some time guidelines that you would say are more geared towards today?
I think that's a great question, and I think the ultimate answer to the question about timelines really depends on the type of product that you're looking at and the type of market you're looking at. Is it over the counter? Is it point of care? Is it clinical lab? Those are all, what is the sample? Those are all really important questions. So let's just assume for the sake of discussion that we choose a relatively simple market and a simple regulatory path, a 510K. One of the things that I have noticed is that we as diagnostic device companies are being treated much more like pharmaceutical companies. So the amount of documentation and regulatory oversight that we face now didn't exist 15 years ago. And as such, I would say, in a weird, strange twist of fate, that 80% of my efforts in my current company are spent building out infrastructure and process to support the regulatory requirements, which is really odd because I'd much rather focus on product development and getting that out to clinicals. So I think our realistic timeline is now, if I were to start, which we did, and probably will be borne out, is about 4 years.
Okay.
But that's in a very simple test case.
Yeah, you're right. No complicated sample prep. Probably the easiest pathway, not necessarily a CLIA waived or at home use where there's lots of room for error.
Correct.
Yeah. Okay, so that's kind of the past. Give us more details on what you've been focusing on now. I know you said your focus is more regulatory, but just kind of get us up to speed on this current product's journey.
Sure. I think every product, I have a personal bias with product development. I know that there are a lot of groups that start based on a novel idea, scientific idea, that really has to take some time to even prove it actually works. We, and myself in particular, are very interested in identifying reagents and technologies that are already proven and we know works and have a good science basis to support its use on clinical samples. So We were quite happy. I was quite happy to already have identified reagents that we could use for our particular condition, so I didn't have to spend a lot of time validating them. There was already a good amount of information on that. And so most of my effort really has been test optimization. I was able, thankfully, from my previous experience, to walk in to the process and kind of already know what I want, which made the process a lot faster. Um, and in this case, working with our test development partner, which we've outsourced, and I highly recommend to do that, is it took us probably 9 months from beginning to end, which I think is still a very accelerated timeline.
Yeah, it is.
And but part of that too, again, is having the knowledge to go in and tell them exactly what you want. And part of it is the robustness of the reagents that we had because we pre-vetted and pre-tested and did everything beforehand. There really wasn't a lot of fiddling around to do. It really was just optimization. So we are currently at the spot of transfer to manufacturing, and we hope to enter clinicals fourth quarter of this year.
So for those of you listening that aren't as familiar with diagnostics, that's different than med device, essentially because there's a lot of chemistry work on the test or the assay, and then there's often a device component with that. So you have a test. Sometimes it's a test or an assay on its own, and it's done in a lab. And then other times there's a device component, which can be a single-use disposable, like a pregnancy test that is used at home. It's just a plastic housing to the test strip, or it can be a whole instrument system. So maybe you're collecting a vial of blood, and then it has a disposable component, but it has this lab instrument that actually runs the test. So there's various levels of each. So John, go into a little bit more detail about what your system looks like, just so we can paint a picture for the listeners.
Absolutely, and I'm happy to do so. Actually, we touch all elements of the device spectrum that you just highlighted. So on the simple side, our first go-to-market is in the point of care space, and that will involve a simple lateral flow test. It's exactly the same technology, as you mentioned, as a pregnancy test. Our over-the-counter device is that test, that housing, that device that holds our reagents and involves the chemistry, is encapsulated in a cassette housing. And so we have that element of the device to think about. We're also taking that and moving that to the next stage, which involves a reader, and then there's analytics on top of that. So we really are involved in all elements of that device spectrum, from the most simple to the most complex. And we're really excited about doing all of it, although I have to tell you, as each step progresses, it gets more and more complex on the regulatory front. And we are, a small team, but our learning curve is incredibly steep at the moment. And we really do rely on the expertise of a lot of outside vendors and consultants to help guide us through a very complex process.
Yeah. Yeah, that's good. And a lot of times you can incorporate that within your team. They essentially become part of your team because it is such a complex project that everybody needs to know what's going on from all different angles.
No question. And to that point, people that I have worked with in the past on the previous company are actually now employees of Flora. And so that's a perfect example of how we were able to incorporate that expertise to help this current effort.
Mm-hmm. So if there were a few things that you could have done differently, maybe after the fact you thought, oh man, I really did that the hard way. What would those be? And that way our listeners that are just starting out, they can really take that and move forward with that advice.
That's a fantastic question. Let me start off by saying what I think we did well and that I wouldn't change, just because that will help, I think, me understand what we would do differently. I think we did a very good job in our fundraising. We did not go to traditional VCs or other institutional investors. We kept it small on the individual level, and that allowed us to retain a lot of control over the direction that we felt we knew better, which we do. As well as choosing the right team. This is incredibly cliche-ish, but having done this several times and having had issues with most every company I've ever dealt with, finding the right team, finding the right business partner, however you want to structure your entity, is probably the single most important thing you can do. If I would provide any advice to anybody, I think it would be to take a look at the technology you're thinking about and really do an in-depth market analysis about what you're trying to do and what you're trying to take to market. There has to be a good economic sense, and developing that understanding of your product's place in the market involves many layers, from intellectual property to medical fit, things that I'm sure you and others on your podcast will address. But you really have to go into it understanding that you have a place in the market for your device. And if you are simply a Me Too product, or if you're trying to be too creative with technology that hasn't been approved by the FDA, or lack an understanding of what the regulatory guidelines are informing you, you're really going to be in for a tough time, and you're really going to have a hard time either maintaining your fundraising levels or continuing forward with product development.
Mm-hmm. So you touched on a really good point that I stress a lot with people, is just the market analysis and market research, and before going all gung-ho, really making sure the market needs what you have to offer. So walk us through that process that you went through.
Okay. I did have a bit of a benefit for me and this entity, because this is the type of stuff that I used to do as a consultant. So I did train myself on how to think about opportunities for other companies before I applied it to myself. But the same process, I think, is relevant here. So just to give some context, I think I spent close to 9 months looking at the market opportunity before we pulled the trigger to say, yes, this is a go. So it took that long, and part of that is to identify thought leaders that you can talk to and get all of the opinions, not just the ones that fit your model, but even dissenting opinions, because then you know what the challenges are. So you absolutely, I think, have to do that. So again, I think part of the market assessment boils down to some pretty fundamental elements, and they are legal. What is the patent landscape? Do you have freedom to operate? This might take some amount of money to get information, but it's well worth it. So that's one part. Two is what is the science behind your technology? Are there publications on it? Do you have a relationship with the actual scientist or inventor? That's, I think, very important. Yeah, so that is a critical element for review. You obviously, part of the opportunity assessment is financial. What is the market size? What are the barriers to entry? The usual typical sort of SWOT analysis, I think, you could quite easily do. And then really a forecast. What is it going to take to develop this? And I would urge people to be as realistic as possible with their forecasting, their cost forecasting, and would say that everything costs at least 2 to 3 times more than you think it will.
Yeah, and that's a good point. You didn't have to go through this necessarily, but for anyone pursuing venture capital, they're going to really scrutinize those numbers and make sure that amount is appropriate. And if you undervalue what you need, and then later on you're asking for more, that's kind of a red flag. You want to have everything fleshed out beforehand and have a really good sense of, okay, it's going to be X amount of dollars, and not be asking for more. So it's always good to build that in beforehand.
Absolutely. In addition to it being a tool for VC to look at for exactly what you described, it also gives them sort of a window into your financial mind, because they want to see how realistic are your planning mechanisms. And I have seen a lot of business plans in my day, and I can tell you that those of us who are either scientists by training that's not really our strength. But as part of the building out your team, and whether it's formally on your company or whether it's informally as a colleague or a consultant, you really need to have the people who you can pass all elements of your assessment through, on your business plan through to get feedback. And I would say the financial end is just as important as everything else.
Mm-hmm. Yeah. So going back to someone that's just starting out, you brought up a good point about just coming from a science background. That's not necessarily your expertise. You were a different case because you did get out there in industry and started consulting and got your feet wet pretty quick there. To that scientist that they are a bench scientist and they have a technology that they're looking to commercialize, what would you say is kind of the first thing that they should do to evaluate whether to move forward?
I think in order for them to move forward, they have to talk to people who have done this before. There are plenty of groups out there whose sole purpose now is to find and vet potential opportunities. So that is a route, as an example, and I'm not endorsing these, I'm just saying they exist. Stanford Medicine X is a fantastic conduit for new technologies to be evaluated. I know that Johnson & Johnson has put a really big push in their J Labs and innovation centers, so those are other areas to talk to, and you get great feedback from individuals who have done this many times over and looked at opportunities. I did want to just mention, because I think this is important, if you were, a pure scientist and let's just take an example. You're at a university and you have basically discovered something that you believe is a cure for X disease. I think it's really important to understand that there is a process by which to protect this discovery. So, researchers obviously like to publish, but publishing is not really that good for patentability issues. So I would encourage scientists to engage their technology transfer office as soon as possible.
Okay, that's a great piece of
Yeah, and maybe
advice.
even ongoing, because there is a process by which things can get protected and patented and pushed out for potential licensing. If you were a scientist that was interested in leaving that role of being a scientist and now moving into a more entrepreneurial role, I will say that it is almost to a fault true that the founders of companies are not usually the ones who end up taking it to the finish line. So it's
Uh-huh.
important to recognize your skill set and not let your ego get in the way. I was fortunate enough to want to go out and get an MBA, which I did, and that has allowed me to sort of sit on both sides of the fence, both as research and as business. So I feel very comfortable in the business role. But it's important to understand what your weaknesses are. And if you need to bring in somebody else, you can't have the ego to say, I really want to do it all myself. Because the end goal is getting it commercialized. That's really where you win.
Yep. Yeah, and thanks for bringing that up too, because I've seen there's different types of CEOs too that depending on where a company's at in the product development process, and even after product development, it makes sense for different types of CEOs. Maybe in the beginning, that scientist just off the bench is able to kind of drive it, but then when it comes to fundraising, are they connected in the VC world, or are they that personality that's going to walk into a room and really sell a table full of investors? Are they really going to get them excited and pumped up and want to invest in their company? Maybe someone else is suited for that, and being the face of the company that really is engaging with the media and getting the word out there. But then later on in product development, when tough things are getting done, maybe you want someone from more of an operations standpoint to really drive the product forward from a project management standpoint. And then after you launch, you need someone really sales driven to get out there and build. Well, you should be building the sales force up before it's on the market, but having that experience and being able to set up those channels. And so So it's tough to find that one person that can fit all of those different roles. And you're exactly right. All of us have strengths and weaknesses, and we want to capitalize on everybody's strengths and then just outsource outsource or hire where we have those weaknesses. So those other people can just highlight our strengths.
Absolutely. Most often, we are our own worst enemies in that sense going forward. And being able to recognize that is a very powerful tool.
Let's see, any parting piece of guidance for us beyond that was a lot for us, which was great.
Well, I apologize. You opened the door, and I'm happy to fill it. I think in parting, I would say to any listeners, I have never felt more gratified in my life doing anything else than this. It's amazingly exciting to watch something go from a concept to full-scale manufacturing, which we are about to do. And I'm happy to do it again and again, as long as many years as I have in me. I'm really excited about being in this space. So I would encourage people to definitely be entrepreneurial and not be afraid to ask questions and seek advice.
All right. Well, thank you.
Of course.
And yeah, I think we all, even me today, I got a lot from your journey and just how I can apply it to my journey and everybody going through this. So thanks for sharing.
Mahalo. Thank you for your time.
I love how you use mahalo too.
I love Hawaii, so it's not a stretch.
Good. Me too. So thanks for sticking with us and listening to this story. And, hopefully in a few years, you'll have a story of your own that you get to share about your product development journey. And maybe you can reference John and say, hey, I listened to episode 16 and I know he loves playing the violin, and I found my grounding activity, and that's what got me through development. So I'd love to hear that. Speaking of sharing with others, if you're not already in our Facebook group, we have a group where you can interact with others. You can share those stories, share resources, anything you want. So go to facebook.com. You can search Inspired by Amua. So we'll see you in there. And until then, Amua.
Mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Amua is here to surf with you. Want to be a master of the waves? Text HANG10, that's all one word, HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyamua.com. Amua.